One of the things I realized as an academic entrepreneur myself was that the resources that I would see available were really appropriate if you were going to be selling a consumer good, if you were selling a product or a service that was more on the marketplace. So if I would go to boot camps and things like that, it would be telling me, for example, why a car company doesn't have a line anymore, like how they innovated on that, or they would be telling me how the Apple phone was started. It just didn't feel like it resonated with me, although if you could extrapolate, the principles we were learning were fabulous, okay? But the examples and the context was really off, okay? It just took a lot of translation, and when I would send people to these things, they would be like, didn't really speak to me. I didn't really know how I could use it, right? So when I looked and I started talking, I found a friend at the University of Pennsylvania, a few friends who saw the same need. And they thought that, you know what, we really should create a book that's specifically for the health and life scientist, the academic entrepreneur who's a health and life scientist, where we take those principles of translational research, of commercialization, but set it in a context that's more about health and medical problems, okay? So what we ended up doing is we thought about that and we said, you know what? We so much want there to be innovation in medicine that we want to give this away for free. We want everyone to have this access because we saw that the vast majority of the entrepreneurs are from more affluent, more resourced environments. We wanted anyone, anywhere, to be able to start thinking about how to do a good job of innovating and trying to improve our wonderful in some ways, but also challenged healthcare system. So in the last year, I partnered with colleagues at the University of Pennsylvania, the Children's Hospital of Philadelphia, and the CTSA called the Institute for Translational Therapeutics. So over the last year, I've partnered with colleagues at the University of Pennsylvania, the Children's Hospital of Philadelphia, and ITMAT to really start thinking about what are the key things that people need to know around this whole commercialization translational research effort. Everything from design thinking to working with the FDA, all these different pieces. And we understand that people who are in the health and life sciences are busy, really busy. Everybody's busy, but in particular, because this is really off their real job, their regular job, which is more about doing research, they're even more busy because these are extra efforts. So we needed to make everything short, to the point, resources useful with the quickest read. You know, I was thinking about a lot of the other resources we have in medicine are very quick snippets of things. So what we ended up doing is work with students in particular to help them start learning this and build the next generation and create tools that are useful to them and paired them up with experts to create the series of chapters that we're going to give away for free in a book that's called Academic Entrepreneurship for the Health and Life Scientist. We tried to make any of the chapters to be an introduction to a topic that gets you started. So any given person will likely not know everything about all of the topics. And so you can go to any of the ones you want. So from a student to a seasoned entrepreneur to an executive, they may find something in there. And it might be that they find, oh, this is a good one I can give to someone so that we can be up to speed and know what it's talking about. Or you yourself can be learning about that technique. That's one part. It's good for all of those. How we think it's going to be deployed is really up to you. We want this to be a community of people who raises the level of the ability to actually translate our research into things that crosses that valley of death to actually have innovation that creates new value. And so we want to see how you want to use this. These are going to be living resources, updated. We hope that people will share ideas, will share their PowerPoints. And one of the ways we think it's going to be very early as a dissemination path is through courses that are offered at the centers around the country that are for translational science, the CTSAs. It's a program out of NIH. These are programs from NIH with a large investment that are about translational research. So we wanted this to be a beginning of a community and a book that can help to train that translational researcher and then actually build on the resources and build. We're going to eventually be turning this into an ebook to make it easier for people to be using. But right now, these are well curated, reviewed, very short research briefs, like briefs on this topic that are going to be in the scholarly commons at the University of Pennsylvania. So the book is designed, it's open source, it's going to be accessible to everyone. And so you might use it because you're curious about a topic. And so you can get in there, read it, learn about it, be done. You maybe want a student, a colleague, a partner to learn about a topic that they maybe didn't know about. So if you're a new business partner who doesn't know what the FDA does, there might be a chapter on the FDA. And so you can just share that with someone. But if you're an academic, you might want to pick and choose and use different chapters as part of one of your classes. You know, they're designed to have resources, you can think of a discussion guide around it. One of the ways my colleague used this at the University of Pennsylvania was that the students had to read the book and then do a sort of blog post based on this. Either add something to the chapter or explain it or look in depth at a piece of it. And those kinds of blog posts, some of them got added to the chapters. So it just makes it richer and richer and richer about how we start thinking about it. So whether you're a student or a seasoned entrepreneur, executive, a busy physician, we think there's something in it for everybody, and we hope that lots of people will access it and contribute to it. Well, I see two parts about why we would have a specific chapter related to women and minorities. The first part is that we know that small business innovation research grants are, if women apply for them and minorities apply, they're as likely, if not more likely, to get the funding as someone who's not a woman or a minority. But we know that they don't apply. They don't know about it. So we wanted to, there are lots of reasons why. One in particular, they just don't know about it. Their group of mentors maybe doesn't know this exists. So we wanted to speak to that audience so that we get that diversity in the pipeline. So why do we want the diversity? Because one of the really important things about making user-centered products is for you to see yourself in the product, in the service, in the program that you're doing. And so we wanted both sides of this. We wanted there to be more inventors who are going through this pipeline, but they maybe didn't see that as a role that they had, and that we wanted to make it more open to them and have them be welcomed into this community. But we also want the inventors to recognize that they may not know and should ask and be curious and empathize with people who don't look or feel or act like they do. They need to create products that are more usable by everybody, programs that are more accessible, more understandable to people who might come from a different background from yours.